Iron deficiency is one of the most common nutritional disorders in the world. It affects over 1.2 billion people globally and can lead to a condition called iron deficiency anemia. But here's the thing, most people don't even realize they're deficient until it begins to affect their quality of life. So in this video, we're breaking it all down: what iron deficiency is, how it affects your body, the types of iron and how to get them, what helps or hurts iron absorption, what foods you need and what to avoid, and most importantly, how to manage or prevent it. Grab your notepad because this is your ultimate iron deficiency cheat sheet in video form. Iron is a mineral, yes, a mineral that your body absolutely needs to function. Its main role, helping to make hemoglobin. That's the protein in your red blood cells that carries oxygen from your lungs to every part of your body. Think of hemoglobin like a delivery truck. Without enough iron, there aren't enough trucks. That means your organs, muscles, and brain don't get the oxygen they need. Iron is also important for brain development, immune function, and temperature regulation. So yeah, it's a big deal. There are two types of iron you can get from food: heme and non-heme iron. Let's break them down. Heme iron is found in animal products like red meat, poultry, and fish. Why it matters: heme iron is much more easily absorbed by the body. In fact, your body absorbs about 15 to 35% of the heme iron you eat. Examples of heme iron sources: tuna, rich in iron and omega-3 fatty acids. Beef, a powerhouse of heme iron, especially liver and red meat. Salmon, a great source of iron and vitamin D. Chicken, especially the dark meat parts like thighs. Offal, organs like liver, kidney and heart, some of the richest sources of heme iron. These are especially helpful for people with high iron needs like pregnant women, children and those recovering from blood loss. A non-heme iron, found in plant-based foods. Why it matters: this iron is not as easily absorbed. Only about 2 to 20% is absorbed. That means you'll need to eat more of it and combine it with other nutrients to boost absorption. Examples of non-heme iron sources: tofu, a great plant protein and iron source, especially for vegans. Cashews, nutritious and packed with iron. Chickpeas, iron-rich and versatile in cooking. Spinach, popular, but note, spinach also contains oxalates that can reduce iron absorption. Lentils, iron and fiber in one. Quinoa, a protein-packed grain alternative. Pumpkin seeds, easy to snack on and iron-rich. Cacao, yes, real cacao, not sugary chocolate, is iron-rich. Vegetarians and vegans can still meet their iron needs, but it takes a little more planning and smart food combining. We'll explain how next. Now here's the game changer. Iron absorption is not just about what you eat, it's about how you eat it. Let's say you're eating a plate full of lentils, that's good. But if you eat them with orange slices or red bell peppers, your body will absorb way more iron. That's because of vitamin C. Vitamin C transforms non-heme iron into a form that your body absorbs more easily. Best vitamin C rich foods to pair with iron-rich meals: broccoli, rich in both vitamin C and fiber. Bell peppers, red ones, have the highest vitamin C content. Oranges, a classic source. Fresh juice or whole fruit. Strawberries, delicious, antioxidant packed and C-rich. Pairing tip: add citrus to your salad, toss bell peppers into your stir fry, or finish your meal with strawberries for dessert. Just like some foods boost iron absorption, others block it. These are the iron enemies. Calcium-rich foods like dairy. Calcium competes with iron for absorption. When you eat dairy-rich foods alongside iron-rich meals, it lowers how much iron your body absorbs. If you need both iron and calcium, don't take them together. Space them out by 2 hours. Tannins are plant compounds that bind to iron in your gut and block absorption. They're found in tea, coffee, and red wine. If you love your morning coffee, wait at least an hour after your iron-rich meal before drinking it. If you take iron supplements, don't take them with dairy, tea, or coffee. Stick to water or citrus juice for best results. So now that you understand iron types, absorption, and blockers, let's get into why people become iron deficient in the first place. There are many reasons, but they all fall into 3 main categories. Not getting enough iron in your diet. This is the most common cause. If your daily meals don't include iron-rich foods, your body gradually runs low on reserves. Who's at risk? People on restrictive diets. Vegans and vegetarians not planning meals carefully. Children and teens going through growth spurts. People with poor appetite or chronic illness. Blood loss. You lose iron when you lose blood. That's because iron is stored in your red blood cells. Common causes of blood loss include heavy periods, menstruation, pregnancy and childbirth, internal bleeding from ulcers or gastrointestinal issues, frequent blood donation, and surgery or trauma. Women of childbearing age are particularly vulnerable to iron deficiency, especially if their periods are heavy. Poor iron absorption. Even if you eat enough iron, your body might not absorb it properly. This can happen due to gastrointestinal disorders like celiac or Crohn's disease, surgeries that remove part of your intestines or stomach, taking medications that lower stomach acid, chronic inflammation or infections. While iron deficiency can affect anyone, some groups are at much higher risk. If you're in one of these groups, you need to be extra proactive. Pregnant women, they need more iron to support the growing baby and placenta. In fact, iron needs nearly double during pregnancy. Infants and young children babies grow rapidly, which increases their iron needs. If not met, it can affect their brain development. Teenage girls. They start menstruating and growing at the same time, which increases iron demands. Women with heavy periods. Losing more blood each month means losing more iron. Endurance. Athletes, they lose iron through sweat and may have increased red blood cell turnover. Vegetarians and vegans, without heme iron in their diet, they must rely on non-heme sources and proper food combinations. People with chronic illnesses, chronic inflammation or kidney disease can interfere with iron metabolism. Let's get practical. Here are a few sample meals that are rich in iron, balanced, and easy to prepare. Alright, let's start with breakfast. Iron-rich option oatmeal topped with pumpkin seeds, cacao nibs, and sliced strawberries. Bonus, add a glass of orange juice for vitamin C. Now for lunch, iron-rich option chickpea and quinoa salad with roasted bell peppers and spinach. Bonus, add a lemon tahini dressing to boost flavor and vitamin C. Finally, let's talk about dinner. Iron-rich option grilled salmon or beef stir-fry with broccoli, red bell peppers, and a side of brown rice. A handful of cashews or roasted chickpeas. Dark chocolate with at least 70% cacao. A smoothie with tofu, berries, and orange juice. Make sure you space out dairy and avoid coffee or tea during meals to maximize iron absorption. Sometimes food alone isn't enough to restore iron levels, especially if you're already deficient. That's when your doctor might recommend iron supplements. Types of iron supplements include ferrous sulfate, which is the most common. There's also ferrous gluconate, which is gentler on the stomach. Finally, ferrous fumarate is a high dose and often used in moderate to severe deficiency. So how should you take them? For best absorption, take them on an empty stomach. It's also beneficial to take them with a source of vitamin C, like orange juice, but you should avoid taking them with calcium, dairy, or caffeine. Now let's talk about common side effects. These can include constipation, nausea, dark-colored stools, and sometimes stomach discomfort. If you experience side effects, talk to your doctor. Don't just stop taking it. There are gentler options or liquid forms available. Your daily iron needs vary depending on your age, gender, and health status. Here's a quick breakdown in milligrams per day. Infants 7 to 12 months need 11 milligrams. Children 1 to 3 years need 7 milligrams. Children 4 to 8 years need 10 milligrams. Boys and girls 9 to 13 years need 8 milligrams. Boys 14 to 18 years need 11 milligrams. Girls 14 to 18 years need 15 milligrams. Adult men 19 to 50 years need 8 milligrams. Adult women 19 to 50 years need 18 milligrams. Pregnant women need 27 milligrams. Lactating women need 9 milligrams, and older adults 51 plus need 8 milligrams. Women need more iron than men do to menstruation, and pregnant women, they need the most. Iron is especially important for babies and toddlers because their brains are developing at lightning speed. Signs of iron deficiency in kids include pale skin, low appetite, delayed growth, irritability or fussiness, poor concentration, and constant fatigue. Best iron-rich foods for kids include iron-fortified cereals, mashed lentils or beans, minced beef or chicken, smoothies with tofu and fruit, and scrambled eggs with spinach. Avoid giving kids cow's milk in excess. It's low in iron and can interfere with absorption. Limit to no more than 16 to 24 ounces a day after age 1. During pregnancy, your blood volume increases by up to 50%. That means your body needs more iron to make more red blood cells for both you and your baby. Iron deficiency during pregnancy can lead to premature birth, low birth weight, developmental delays, extreme fatigue in the mother, and a higher risk of infections. Tips for pregnant women include both heme and non-heme iron in your meals. Take prenatal vitamins with iron, but always consult your doctor first. Eat iron-rich snacks like dried fruits and nuts. And don't forget to boost your meals with vitamin C sources. If you suspect you're iron deficient, don't guess. Get tested. A simple blood test can check your hemoglobin and ferritin levels. Signs you should see a doctor include constant fatigue that doesn't go away with rest, pale or yellowish skin, shortness of breath, chest pain, unusual cravings like ice or dirt, a fast or irregular heartbeat, and hair loss or brittle nails. Treatment options may include dietary changes, iron supplements, and in severe cases, IV iron or blood transfusions. Self-medicating with iron supplements can be dangerous. Too much iron can harm your liver and other organs. Iron deficiency is common, but it's also manageable. With the right knowledge, food choices, and timing, you can stay ahead of it. Key takeaways: eat both heme and non-heme iron sources, pair iron with vitamin C, avoid calcium and tannins around iron-rich meals, understand your body's needs based on age, gender, and life stage, and when in doubt, get tested. Because when your iron is in balance, your energy returns, your focus sharpens, and life just feels better. If you found this helpful, don't forget to subscribe to Drug Insight Hub for more clear, actionable insights on medications, health conditions, and the science behind them.